Hi, everyone, and welcome to the West Hollywood COVID-19 webinar series. We are really sorry that we are starting about 10 minutes behind schedule. There were some technical difficulties on the back end in getting the LA County Department of Public Health on the webinar platform. So that portion of today's program will not be happening. However, we do have Dr. Murthy from Cedars-Sinai here to give today's presentation in regards to COVID-19. But for the LA County Public Health portion, we will be rescheduling that for a future date. So please make sure to stay online to the City of West Hollywood's COVID-19 website at www.weho.org/coronavirus. So today's topic is COVID-19 health information. And with that, I'd like to turn it over to Sienna Lung, the city's HR supervisor, to introduce today's speaker.
Hi, good afternoon, everyone. This is Sienna with City of West Hollywood. We'd like to introduce our speaker, Dr. Rika Murthy. She is the Vice President of Medical Affairs and Associate Chief Medical Officer at Cedars-Sinai Medical Center. She's also a professor of medicine in the Division of Infectious Disease at Cedars-Sinai and professor of clinical medicine at UCLA School of Medicine. Dr. Murthy's clinical and research interests includes prevention of healthcare-acquired infections, HAI, epidemiology of emerging community disease, and multi-drug resistant organism, and antimicrobial management and device-associated infection. She has also co-authored several book chapters and numerous abstracts and articles on these and other subjects for peer-reviewed journals, and frequently sought as a speaker on these topics. So here you go, Dr. Rika Murthy, here's to you.
Great, thank you so much. Thank you, first of all, for the invitation to join this webinar and be able to share some updates from the healthcare side around COVID-19, and certainly in support of our community in West Hollywood, where Cedars-Sinai Medical Center is certainly very involved and is part of our community. So I thought what I might do is just go through some general updates and kind of new information with respect to what's happening in our community. None of this is really new, but just to set the stage for hopefully some time for questions during a latter part of the discussion. So I'll just start off with some kind of general comments about where we are today. Certainly, as you are aware, we're continuing to monitor and assess the activity in Los Angeles. And of course, with the developing news that with the escalation of the numbers of new cases and the number of hospitalizations in LA County, the governor and mayor have instituted additional rollbacks in some of the reopening. So I can speak to some of the observations at Cedars-Sinai that really are mirroring what we're hearing in the community. We are seeing an increase in hospitalizations to Cedars-Sinai and in the recent 2 weeks. And interestingly, that this is not a sudden spike as we experienced earlier in the year in about March or April. This is more of a gradual increase, but the concern is it's really going in the wrong direction. There are some observations that I can share with you about what we're seeing in the hospital, and it's very similar to what's being described across LA County in the hospitals in our area. And that is the population that we're seeing has shifted from earlier this year, where it was largely elderly patients or those who were very ill, needing ICU care and requiring being on ventilation with breathing machines. We're seeing a shift over the last couple of weeks to younger patients. And while on the one hand, the numbers of patients we're seeing is alarming, if there's any, one of the other trends is that as they're being admitted to the hospital, there are equal numbers of requiring care in the intensive care unit, but there are actually fewer numbers, about half are requiring mechanical ventilation. So I think there's some disturbing trends, but also some, at least the reflecting of the age and younger population and the lesser underlying illnesses. We're seeing better outcomes and less severe illness in some of these patients. It is very clear, however, with this change in the age and the younger population, it is very clearly seems to be correlated with a reduction in the vigilance among the public in these patients with the safety and protection measures that have been in place before the rollback. So, masking, physical distancing, and this increase seems to be correlated with the reopening in LA County, and particularly some of the data suggested that the large numbers of people who have been out in the public. I know the protests are one of the concerns. While it seems protests may have played some degree of an impact, it certainly seems to be much more likely to do with the broader presence in the public without the use of masks, without the social distancing. So I think those are some important observations. We have seen earlier this week that the governor has added some additional shutdowns, and if there are additional closures, then we'll only see the impact of those, as we did before, after 2 to 3 weeks. So the immediate concern is the numbers of cases are continuing to rise, and whatever interventions are put now, and even if we really strengthen our vigilance, we won't see an impact for a couple of weeks. So we have to be prepared for this ongoing increase in cases. I would add a few points. One, we're now several months into this pandemic here in our experience in the United States and in LA County, and we've learned a lot. There's been a tremendous amount of science that has evolved, not only in detection and testing, but also in treatment, and I can touch on some of those. So we have lots of experience at Cedars-Sinai and our other hospitals, but I can speak to our experience at Cedars-Sinai, that there's been a tremendous amount of experience gained among our care providers in identifying patients, in treating them in the hospital, whether it's on the floor or in the intensive care unit. There are standardized protocols, the care teams that have been developed, and the models of care have become, our teams have become expert in caring for these patients. And I will say that as of last week, among the COVID-19 patients who were admitted to Cedars-Sinai and finished their course of treatment, about 87% of them have been discharged to continue their recovery. So I think that's a testament to not only the aggressive early care models, really early interventions, and our expert care in the ICUs, and the treatment approaches, lots of treatment protocols that have been introduced. And then I'll add another item around Cedars-Sinai. Cedars-Sinai has been, for the last 5 years, one of the federally funded centers for treatment of highly infectious communicable diseases like Ebola and now coronavirus. And so there's a tremendous amount of expertise among the care teams and in dealing with responding to infectious diseases outbreaks. And the last thing before I go into some common discussions about the science and what we know is that, as I mentioned, the treatment guidance has rapidly developed and is continuing to develop for managing patients with COVID, where we started with earlier on, where it was largely only supportive care without, whether it's fluids and putting the patients in an ICU and providing them breathing support. It has evolved over the last few months with very significant advances in treatment research protocols and availability of options to manage these patients. So I will point out that for mild illness, however, the treatment is still supportive. So if somebody's not sick enough to be in the hospital, the approach is still the same in being able to provide self-care, rest, isolation from other people, and making sure the individual is hydrated and monitoring closely for symptoms of worsening. If somebody's sick enough to be in the hospital, there are teams that are established at Cedars-Sinai that all therapies that are possible are investigated and swiftly being able to enroll patients into treatment options that may be available to them. There are some very promising trials, and our teams are organized to be able to rapidly identify patients who are ill enough to be in an ICU or be in the hospital, and determine among the menu of options which might be best for them, and they and their families are contacted very quickly. There are new antiviral medications, and there's also been new data out there around plasma, donated plasma. So a number of different options that have been introduced, and some that have been scaled back because the data has not been effective. So I just wanted to start with those introductory comments just about the current status of the pandemic in LA and also at Cedars-Sinai. Just want to step back a little bit to reestablish what we know about COVID-19 and since the beginning of this pandemic. And I'll start off by saying that we've learned a few things, but essentially there's not a dramatic change in what we know about the virus. And I'll start off with the fact that this virus is a very novel virus, and that's part of the reason we have this massive pandemic, because it has certain features that lend itself to the situation we're in now of this ongoing transmission. First of all, because it's a novel virus, our population has no immunity to it. There's no detection or recognition of this virus that might even give partial immunity. Even though it's among a family of coronaviruses, this particular one, it appears has is emerged, and at a time where the rest of the community, the rest of our population has no experience with it. Secondly, it has a very high ability, a very efficient means of spread. So it seems to be highly infectious and highly contagious among people. And by doing so, between both with respiratory droplets as well as by picking up touching a surface when somebody might have coughed or sneezed, those two vehicles provide the ability for rapid spread among the vicinity of people who might be exposed. And so the combination of a respiratory droplet, where somebody coughs or sneezes and the virus is carried from the upper airway into an area within 6 feet where the droplets might land on somebody's face or land on a surface when somebody picks it up and touches the eyes, nose, or mouth. So that mechanism of transmission is very effective, and it seems to be the reason why it's highly easily spread among families and among close contacts. Thirdly, it has a very long incubation period. Most viruses, such as the common cold or influenza, when somebody's exposed, if you're going to get ill, you get ill very quickly, within 24 hours or 2 to 3 days. And most of us can relate to an experience of being on an airplane in the past, where within a day or two, we might have become ill, and it's usually probably because we were exposed. But this virus appears to have a long incubation period, generally around 5 to 7 days, and possibly up to, in some cases, 12 to 14 days. And so that really allows its ability for somebody who may not be aware that they are developing illness to spread to others very rapidly and large numbers of people because of its ability to spread over that long period of time. And then additionally, another element of that, of course, is we've learned that the ability for this virus to spread is actually very high just before somebody gets sick. So there's pre-symptomatic spread because they carry large numbers of virus in their upper airway. And also people who don't have symptoms or have very, very mild symptoms are as infectious as those who may have kind of open illness. So those are some of the elements that can actually lend itself to the variables that lend itself to why we're seeing such rapid spread and ongoing spread. Without those interventions of stopping those two mechanisms of transmission, the respiratory droplet and the contact touching surfaces, it just seems to be going through these phases of sort of waxing and waning and spread. So the final point I'll make with respect to the what we've learned, what we know about the illness, is that the spectrum of illness is very wide. As I mentioned, there are individuals who can be completely asymptomatic or may have a very mild symptoms, either a sore throat, or they may have symptoms that are early on not respiratory, might have some low-grade temperature, or might have diarrhea or other symptoms, loss of taste or smell, that we wouldn't ordinarily associate with a viral illness that we think of like a cold. So those are some reasons why we're seeing large numbers of people that we don't know about, probably, compared to those who are in the hospital. Probably 80% at this point, the estimates are around 80% of people who have COVID-19 in their system actually probably don't know it. And it's only 20% that we're seeing in the hospital. So every one patient we see in the hospital, there's probably 4 or 5 others in the community who have the infection and can serve as a source of spread. So those are some of the elements that I think lead us to the recognition that we're in this for the long haul. The symptoms can be very broad. I mentioned that what triggers people to come to the hospital maybe more severe symptoms such as respiratory illness, trouble breathing, high fever, and less so symptoms like a mild cold or slight nausea or diarrhea. But all of those can be indicative of early signs of COVID. So I think at the moment where we are is that we have only prevention as our major tool at this point to be able to contain the ongoing spread of this virus in our community, because there is no other prevention other than containing the source of infection from those who are infected and preventing the spread. And it seems because of the rapidity of spread and the long incubation period, these drastic measures that have been put in place in California, which were very effective, if you recall, compared to what we saw happening in New York. California was one of the first states to introduce the safer at home and distancing measures, closure in the healthcare setting, stopping elective surgeries, making sure we mobilize our healthcare system. So I'm going to pause in a minute for questions with ending on a couple of points that I think key messages I would want to convey are that we have to continue to not to ease up on any of the preventive measures that we have available to us, especially as we are now in the second wave that seems to really confirm that those initial interventions did have an impact in reducing spread in our community, because we saw the number of cases go down that are hospitalized patients, and we saw the number of deaths as a result go down. We are now seeing a reversal of that trend. We are seeing people gathering more, and that's very clearly appears to be linked to the increase in cases. So there's no doubt that there's a lot of fatigue in our community, and with it a sense of frustration that we have to continue these measures. So we do need to reinforce that at best, at the moment, that's what we have available to us. To be vigilant and continue to contain our spread. How can we do that? Masking works because it contains the secretions and the potential for spread for somebody who may be carrying the virus and doesn't know it. Whether you're symptomatic or not, if you cough or sneeze, then you can be transmitting virus without even being aware. And though we have some testing available, we are not at a scale to be able to test everybody all the time. So wearing a mask serves to contain the secretions, to not only protect those around you, but also to some degree ensure that we're sustaining that. It's become, I think, a norm, and it will continue to be a norm for some time until we have vaccine available and have enough people develop immunity from vaccine, which hopefully will be demonstrated with the early promising signs of vaccine efficacy. And secondly, washing hands. That, again, as I mentioned, the contacting surfaces, whether you're out in public or even at home, the routine of hand hygiene it just needs to be a norm, because avoiding touching your eyes and mouth and face is really one of the bigger risks. And then thirdly, physical distancing or social distancing. That 6 feet number comes from science that demonstrates that the virus, the particles, the droplets that when somebody coughs and sneezes can go out to about up to 6 feet. Typically it's shorter. The data around droplet transmission of viruses is roughly around 3 feet. But because of an abundance of caution and with some of the newer data, it really pushing out to 6 feet is the sort of the current thinking, and that's the best science. So ensuring that we have social distancing is a key. And as we've seen, this is a silent enemy. We're not able to detect it without really testing, and the testing is limited. So we have to assume everybody could be potentially harboring it until we are able to get enough vaccine in place and be able to slow the spread so that we can really contain the impact on our healthcare systems, as well as being able to prevent people from getting ill and have serious consequences. This is not a let's put it this way. Many people may have mild symptoms. For those who get very ill, it can cause very severe illness. So there are significant consequences to getting ill that we can prevent by doing these simple measures. So let me pause there. I know I want to be able to open it up for questions and be more specific if there are specific questions.
Yes, Dr. Murphy, here are some questions that we received prior to the webinar. I know that you might have them, so I'm just going to skip over to the ones that maybe is a little bit more little different. Is there anything we can do to strengthen our immune system, like taking vitamin C, exercise, etc., aside from social distancing and wearing masks?
I think the best care at this point, like with any viral illnesses, is that prevention is really the best key. What you can do to boost your immune system is no different than what you would do for general health, self-care, good nutrition, hydration. There isn't a magic bullet for COVID-19 that you wouldn't be what you would do for any other kind of general self-care.
Okay. And what is your recommendation regarding face masks, comparing cloth masks and disposable one? Is there in certain environment that a particular type of face mask proved to be more effective?
So I think the answer to that is yes. And that situation is in very specific settings in healthcare. With respect to the use of the specialized mask for what are called the N95 masks, which is kind of the highest level of filtration. And let me give an example of what that means. So by going to that detail, I will just sort of answer the question by saying, for the general public, using any kind of face covering, whether it's cloth or disposable, is equally efficacious. And the intent of that, as I mentioned in my earlier comments, is to ensure what we call source control, that the person who may be harboring the virus is containing it to prevent the secretions from actually leaking out. If you do that and you maintain distance, that's going to be the most effective use of masks. Masks in and of themselves don't prevent you from acquiring the virus by itself, because of the fact that, it can occur from splashing on the face or touching eyes, nose, and mouth. And masks by themselves are not necessarily the only efficient source of preventing acquiring the virus. In the healthcare setting, however, the use of the N95 mask is very specialized for settings in patients where there is a very high risk of small, tiny particles that might be suspended because we're doing things for the patient, such as putting a breathing tube down, for example, where you're actually preventing getting past the upper airway and you're releasing aerosols and small particles that could be lifted and get into your eyes, nose, or mouth, or get around the mask. And that's where the N95 masks are really dedicated. And because they're also in short supply, I think the general recommendation is really reserve. The science doesn't support its need for its use outside of healthcare settings, and for this pandemic, and for the general public in business settings and others, that the standard masks for general personnel and in the general public is recommended.
There's a mask-related question on our live feed. Someone asked, if you are wearing a mask, which is non-N95, when around someone for more than 15 minutes and less than 6 feet, and later found out that person tested positive, should you quarantine yourself? If so, for how long?
So I think the question is, so most of our guidance comes from the Centers for Disease Control. And our LA County colleagues and our health department interprets that information and issues guidance for our local use. So in that specific setting, if I have to remember what the setting was, if somebody is wearing a mask, and so the individual asking the question may be wearing a mask, and they're in a setting where they were exposed to somebody within 6 feet. Is that what was it?
Yes, with someone around someone more than 15 minutes and less than 6 feet apart, and then find out that the other person is positive.
Right. So if you're wearing a mask when you're around somebody for more than 15 minutes and less than 6 feet, and that individual was not masked, and those are the kind of questions. The risk if you were wearing a mask and the other individual with a mask is extremely low. And unless you actually were interacting with them in some way, you had contact with surfaces. So it really depends on an individual case. It's worth asking the question, what was the interaction with them? If they were just happened to be in the same space and both people were masked and there was no other interaction, the risk is extremely negligible to low. And that's why that concept, these are surveillance definitions. They aren't necessarily hard and fast. If there was an individual, for example, who was unable to keep their mask on, that might be a different setting, because if they were actively coughing and you were within 6 feet for prolonged periods of time, that may be a setting if you didn't have a face shield. So in the healthcare setting, we would go down that concept of contact tracing to really understand that specific individual's exposure risks. So I think that in this setting that was described, the risk would be very low. But those are the kinds of things that the public health has really mobilized a tremendous effort around contact tracing. So for those individuals who are identified to be positive, there is a follow-up of those individuals to find out who might have been exposed and really understand what's the risk of that exposure to others. And they would start with the person who was diagnosed to say, okay, what was the setting this individual was in? Were they wearing the appropriate masks? What was the risk of that person infecting other people? That might be different if you're a household contact, for example, a household member of that person who was positive.
Okay. Another question is, are there certain underlying health conditions that make COVID-19 more dangerous to infected patients?
The answer is yes. That we've learned in the risk factors for more severe illness, in more severe illness and death, are in people who have underlying illnesses or chronic illnesses, such as diabetes or cancer or other highly immunosuppressive conditions. And so it's definitely important to be aware that even if you are young, you are healthy, have no comorbid conditions, there might be others that might be exposed in your family, loved ones, friends, who may have higher risk. And that is the other reason that it's really important to think about the potential for protecting and potential for spread to our vulnerable populations. So elderly age is another element, and we've seen some of the worst outcomes earlier in the last couple of months at the beginning of the outbreak, as in those who had those underlying conditions, nursing home patients and the very elderly, who are very vulnerable because of the severity of pulmonary and respiratory infection. And once somebody ends up being in an ICU and being on a breathing machine, their ability to recover and be able to fully be back to the full function gets severely impaired, their ability to heal.
Okay, I think this is also related. When working with an older population, for example, 50 years old and plus, should workers get tested on a regular basis?
So there's some guidance from LA, from our health department colleagues, and I know we'll hear more about that in another session, but there are recommendations specifically for certain populations like skilled nursing facilities. So there's not specific guidance about all settings, but that's the kind of thing that might be determined on an individual individual case. In the healthcare and the hospital setting, for example, there are not routine testing in place for individuals, for staff working in the hospitals, for example. So but because of the severe outcomes in this pandemic with nursing home populations, there was specific guidance for selected nursing homes or some nursing homes to get routine testing. So it depends on the setting, and that's the kind of guidance that we would look to from our health department colleagues. Certainly, if there are clusters of cases, or if there's increasing numbers of cases or large numbers, then in those settings, if there's outbreaks, for example, or trends that are going in the wrong direction, those might be thresholds and triggers that might lead to either the health department or the facility deciding that we want to start doing this so we can actually identify and do contact tracing and limit. But as a routine, it's not yet a recommendation to do that routinely.
Okay. I don't know this is a question that you'll be able to answer, but maybe it's more on your opinion, your medical opinion. Why are other countries recovering faster than us?
That's a great question. And it's probably a combination of factors. And I think I don't want to get into a lot of non-clinical related topics, but I think there's clearly a few differences. We have a system that is driven by individual states and regional areas. Even though we have a kind of a federal guidance from the CDC, there isn't the actual jurisdictional decisions for managing public health interventions are coordinated at a state and local level. So we've seen variation in the approaches, as you've seen, which are both from a public health standpoint and also from the governmental side. And so that's probably one of the reasons. And I think the other is just the challenges in the reinforcement and compliance. So many countries have a one national health system and a very clear message that is unified and is sort of managed all the way down through the different sectors. And in our society, in our country, we have quite a bit of variability.
Thank you. I see a couple questions up there, but they're mostly regarding business opening and guidance and restrictions. So I want to let the participant know that our other presenter, Ms. Kristen Mundy is unable to connect today due to technical difficulties. So we will have a second section. Those guidance from the Department of Public Health, those questions will be maybe more appropriate to address in this session. At the current section, Dr. Murphy is providing us guidance about the medical part of the disease. So if there's anyone who has additional questions regarding the illness itself, I'm able to provide answer for a few more questions. Other than that, I can save the question that you asked for this next session.
Great. And I don't see any other questions queuing up here on the questions tab. But definitely, as we said before, we really definitely want to thank our partners at Cedars-Sinai Medical Center. You're an amazing partner here with us in the city of West Hollywood, and I know other surrounding cities in our area. So thank you for all of your hard work and outreach and getting the important information across to all of our constituents. Yes, so like Sienna said, we will market the second part of this webinar, which will have the County of Los Angeles Public Health Department on to talk about specific reopening for businesses and guidance for businesses and the workforce. You can find more information on that by visiting our website at www.weho.org/coronavirus. And you'll also get an email with the recording of this webinar right after the webinar is finished. And with that, I think that is everything, unless Dr. Murthy, if you want any last words.
Sure, thank you. I would like to just close with an urging our community to really make sure that you're all beyond practicing the safe prevention measures we've talked about COVID, but also not to forget that to take care of your basic healthcare needs and reinforce that it's really important and it is safe to get care at Cedars-Sinai. That we are still managing to take care of the majority of patients that are not COVID, even though we're seeing increasing trends. And I think that's a really important message. I think early on, there were a lot of fears about going to the hospital because of concern you might be exposed to COVID. But in reality, the majority of our patients, over 90%, are non-COVID. And we are open, we are taking care of the needs of our patients and our community. And if you are, so we would urge people who are ill or feeling ill not to delay their care because of what's happening or concerns about the pandemic. There are strict safety protocols in place, and not only health screenings, screening temperature checks and health screenings for everybody entering, not just visitors, all staff as well. For everybody who enters the medical center, and so there are options also for, of course, in-person and telehealth. So we're evolving and making sure that the care is being delivered to all those who need, as we are in this for the longer haul. And I think the only other thing I'll say is, even though there are concerns about the increasing numbers of cases, we are not at the situation we were a couple of months ago, where there are worries about the healthcare systems being overwhelmed 2 months ago. That's always a concern if we don't slow the spread now. But at present, there is bed capacity. We have personal protective equipment for our staff to be able to provide safe care. And so we're making sure our staff are protected, and we want to make sure they are able to take care of our community and our patients. So please make sure that we encourage our community to seek the care they need.
Great. Thank you. Thank you so much, Dr. Murthy. And with that, please make sure to visit the city's website for the latest coronavirus updates at www.weho.org/coronavirus. Until next time's COVID-19 webinar series, have a great day, everyone.